Hi, I'm Dr. Deborah Garrison with Jake, and we have some important information we'd like to share with you.
Hello, Stephanie.
Hi, Doctor.
Hi, Mickey. So I hear that Mickey's been scratching like crazy. How long has this been going on?
Well, actually, he does better during the fall and winter, but every spring his skin problems seem to flare up. And I've been very diligent with flea control, and I keep him very clean.
Well, let's have a look. Yeah, it seems like I can see here in his groin and also his lower back, and moving up to his face and his ears as well. And you can see the redness and the inflammation. That's from him scratching himself so much.
Yeah.
Is this pattern pretty typical?
It's pretty amazing, but this pattern does seem to repeat itself. You know, and I also find him that he's itching inside his thigh, under his front legs, and occasionally even with his feet. Why does he do this to himself?
Well, based on the pattern and the seasonal nature, it seems like Mickey's suffering from seasonal inhaled allergies we call atopic dermatitis. I mean, dogs can be allergic to many things. Foods and fleas and environmental pollens, for example, which can be either inhaled or even absorbed through the skin. Things like tobacco and wool and house dust mites, etc. But we can often tell a lot from where the lesions seem to be most prevalent on the body. And with Mickey, it seems like he's suffering from atopy and with even a little bit of flea allergy as well.
So, Doc, what do we do now? I mean, Mickey's miserable. Are these allergies curable?
Well, we can't cure them, but we can control them. I mean, the perfect goal would be to treat his clinical signs on the one hand while we try to identify what he's allergic to on the other. Now, obviously, with some things like foods and fleas, we can practice avoidance. But when it comes to pollens and the other environmental allergens, they're pretty tough to avoid.
And how can we figure out what Mickey's allergic to?
Well, that's the challenge. There are some tests, but veterinarians seem to have their preferences as to which one they like best. Ideally, if I can identify exactly what we're allergic to and then have you followed home with some hyposensitization injections, that would be great. But these aren't always practical to do. The tests aren't always very effective, and a lot of parents don't like to give shots at home. So what we do is we concentrate again on the clinical signs. So we will relieve the itching and the discomfort with medicated baths and supplements that have omega-3 and other fatty acids, some antihistamines. We'll treat the secondary skin infection with antibiotics, and even often we'll resort to very short-term oral cortisone as well.
Well, that doesn't sound too difficult. Can we get started with Mickey's treatments? Because he is miserable, and since I'm not too squeamish about giving him any injections, I'd like to get started on his test as well. Can we get started with something today?
Oh, absolutely. What I'd like to do then today is let me keep him. We'll do the first medicated bath, and I will take the tests, and then prepare some medications and supplements for you to use at home that you can continue to treat the skin and relieve the itching and the discomfort. So I need him for a couple of hours, and you'll pick him up later on?
Great. Thank you so much, Doctor.
Great. If your pet seems to be scratching certain areas a lot or having persistent seasonal allergies, chances are he is suffering from atopic dermatitis. Now, these allergies can't be cured, but they can be controlled. So while you're here, ask us what you can do to help keep your pets more comfortable. Thanks for joining us on Pet Care TV. I'm Dr. Jeff Werber, and we'll be right back.
Thank you for watching our video. Please take a moment to visit our websites. Dr. Deborah Garrison at the Treshweek Veterinary Clinic, loveyourdog.com, loveyourcat.com, tvet.com, mypetcaretv.com, and petdocsoncall.com. Thank you, and we wish you and your pet a happy and long life.